The biggest challenge was his survival.
Come on, son, we gotta make it. We're gonna make it.
Please don't let my baby die without my wife coming to see him.
Just pray he makes it.
The day Tommy was born, Dr. Peverini, the neonatologist, was there in the delivery room, and he took Tommy and fought with him. Tommy's APGAR scores were 1, 1, and 1. He was blue-gray, 0 would be stillborn. He was 3 months premature, 1 pound, 6 ounces, and they fought with him trying to get him on the ventilator and to respond to medications and to the techniques that they were using. Every day the challenge was just him breathing and living. Every day was the hardest thing you could ever imagine. Hardest thing.
My wedding band would fit on his little hand, but I didn't want to push it on because he was so transparent. His skin hadn't really developed completely that I didn't want to push it, So, but he was a small baby.
He's
very small.
Tiny.
Very small.
Very tiny.
Yeah.
I understand how scary it is to have this unexpected event that what they assume would go very well now for some reason is requiring that their baby be in an ICU. And when a mom or dad first walks in and may see their baby connected to mechanical ventilation, there's all our various monitors, and there are lines that help us to measure blood pressure or to give IV antibiotics. If you've not seen that before, it's very overwhelming, and it's also very scary.
Dr. Hopper told me that he had air on his heart, in the sac of his heart, had hypertension. And he said, I can try ECMO, or I'll give your baby about a half an hour to live. And so I said, let's go.
ECMO stands for extracorporeal membrane oxygenation. Basically, it's an artificial heart-lung machine. And so it's a way of really resting a patient's heart and lungs until they can recover.
I got to see him the next day, and to me, he looked good. Everybody was expecting me to, be overwhelmed, but the night previous when I had seen him, he looked dead. They were telling us that worst case scenario was he'd have severe mental retardation, severe cerebral palsy.
Dr. Hopper could have easily said, I think it's a little bit too late for your son. But he didn't. He said, let's try this. And as a parent, that's all you want.
We are going to do the best to really do two things. One is to provide the best medical neonatal care that we have access to involve as many people in making the best decisions. And then the second part of our task is then to communicate back to mom and dad, this is what's taken place, this is the change. There's lots of moms and dads that don't say it, but they're thinking in the back of their minds, is my baby even have a good chance to survive? And that's certainly true when a baby's born very prematurely, or a baby's born with some unexpected cardiac problem or some other thing that requires emergency surgery. And so I try and assure families that I and others on the team are unable to predict the future, but we're going to do the very best.
In the NICU, we're a big team, and we all feel like we're related. And we try to include the families in that too. I see my babies as potential wonderful adults and a part of a wonderful family that they need to go home to. So I always call myself Auntie Lorene, because to me, I'm part of the family, but not their mommy.
Loma Linda's amazing. We were going through probably the worst time in our life.
We did a lot of crying at Loma Linda. Some was for sadness, and some was for joy. Because it was a ride that I wouldn't wish on anybody. But if you have to take the ride, we were with the right people.
I call Tommy God's little miracle, and everybody who knows him says the same thing. Everything was stacked against him. This little guy who was about smaller than a sheet of paper weighed about 4 cubes of butter. How can something like that live outside of a womb? It can't. You know, it just can't. But he did.
By Angie.
You know, when he was born, we named him Brandon Rocco because he was a fighter. Today we call him the Rock Monster because he's 3. The biggest compliment of his life, the Rock Monster. He was Humpty Dumpty, and it took everybody at Loma Linda to put him together again with the help of God.
His right hand didn't work as well as the other one, but today, after aggressive therapy and all the toys that he plays with, you can't even really tell. He has great use of both hands now. And the same with his legs. His legs were a little bit weaker, so you put him on the bike and he acts like a 3-year-old little boy. It's amazing what Brandon has overcome in a short amount of time.
And we'll have Brandon for the rest of our lives. And we'll always be thankful to Dr. Hopper and everybody at Loma Linda for what they did.
Wheels on a bus go round and round.
The issues that he has today from his prematurity is he has a slight right leg muscle deficiency due to prematurity and lack of oxygen. So the prognosis that he was to have, which was cerebral palsy and severe mental retardation and slow developmental skills, have all been diminished. He's got the most vivacious personality. He really does. He is just a loving, sweet kid. And I'm told all the time, and I'm not kidding, all the time, he's like a miniature Harry Potter. Oh, he looks like Harry Potter.
Let's adjust that microphone. I'm going to turn 4.
So he is forever my Labor Day baby instead of my Christmas baby.
Now I have girl lipstick.
Yes, you do.
We're looking forward to implementing in our unit on behalf of our babies and their parents a system called NICU Link or NICU Link. The intent is for us to be able to improve the communication between parents and our team. Some babies, we know ahead of time that they're going to need some surgical care or some other subspecialty care. But oftentimes, what was expected to be a normal delivery and a baby that is home in 2 or 3 days turns into this unexpected emergency. So to just say the words, "my baby is in the neonatal ICU," is very scary. To be able to see one's son or one's daughter and to be able to interact with the team that's surrounding the baby and the care is, I think, going to be able to lessen the anxiety that is surrounding this. There are babies that, as you may very well know, have to stay in our hospital as long as 3, 4, 5 months. Imagine having challenges with transportation such that you can only get here once a week. And imagine being able to essentially dial in and tantamount to Skype in with one's baby and be able to check in with the team and the nurse and the physician might also be another extension of this initial phase. I just want to take the opportunity to thank the team at ICG for doing something that I think is very creative. The idea of writing a check is different than the idea of having a specific goal. There's nothing in my mind as powerful as being able to walk to the bedside of a baby and say to someone, because of your generosity, we now have either this new monitor or this new tool that has improved the care of babies. We think that whenever we partner with someone that is supporting our mission, they are an extension of it. And so I would welcome anyone at the ICG team to come visit us and to come see what is the impact of this tool.